And thank you so much for recording. This is the Healing Advocacy Fund end of year media briefing. We'll start sharing our screens here and we'll get right into it. So just quick housekeeping. If you all, while you're not speaking, could stay muted, that would be great. If you have questions, generally speaking, we're going to hold them until the end. You're welcome to put them in the chat if you would like, but we will kind of wait till our Q&A portion once the presentation is over to answer them. So with that, you also may record. Yes, go for it. Thanks for asking. And this recording will be shared publicly as well after the fact. So we'll post this on YouTube probably tomorrow. All right. Speakers ready? Okay, let's get to it. Okay. All right, as I said, this is the end of year media briefing for the Healing Advocacy Fund. We'll be discussing 2024 and a look ahead at 2025. So this is our list of speakers. I'll also ask the speakers to quickly go around the room and introduce themselves, starting with Heidi.
Hi, everyone. I'm Heidi Pendergast. I'm the Oregon Director for the Healing Advocacy Fund. Thanks for being here.
Hi, everyone. My name is Adi Ray. I am the co-director of OPEN. That's the Open Psychedelic Evaluation Nexus, which is a research group headquartered at Oregon Health and Science University. I'm also an assistant scientist at Legacy Health, and all of the information that I have to share today is from the perspective of my research team. I'm not representing Legacy.
Hello, everyone. My name is Tal Sharabi, and I'm a licensed counselor, mental health counselor, specializing in somatic work. And I'm also a facilitator at InnerTrack and a lead educator in their training program. I've been with InnerTrack since the very beginning, and we just graduated our third cohort and about to start the fourth. I'm also not representing InnerTrack here, and just my own perspective and experience as a therapist and as a facilitator.
All right. And Heidi, I'll pass it off to you.
Thanks so much, Lizzie. Welcome, everyone. So today we'll be providing a brief overview of Oregon's psilocybin program, just a little bit of a recap. And then we'll talk about some of the key 2024 achievements. We'll provide a preview of some notable things that are in the works for 2025, and we'll leave some room for questions at the end. Next slide. So before we get started, I just want to review. So Healing Advocacy Fund is a 501c3 nonprofit organization, and we work to expand and protect state-regulated access to psychedelics with a specific focus on safety and accessibility. We are not the Oregon Health Authority. They are the regulatory body of this program and responsible for standing up and implementing Measure 109. So a lot of what we'll talk about are the rules that they've put into place in standing up this program. Next slide. So Healing Advocacy Fund got started just after the passage of Measure 109 in 2020. And we did it with wanting to get involved in the implementation, making sure, again, that safety and accessibility were really baked into the program from the beginning. Since that time, in 2022, Colorado voters passed Prop 122, establishing their own natural medicines program, which created a similar but slightly different legal framework for state-regulated access to psychedelics. So now we have two teams in Oregon and in Colorado, the only states that have state-regulated access to psychedelic programs. Next slide. So let's talk a little bit about what the Oregon psilocybin program is and what it is not. So this is a highly regulated program. Everything from the licensed facilitators to the service centers, labs, manufacturers, all of these are licensed and regulated through the state of Oregon. There's an extensive product tracking system, so the Oregon Health Authority knows where all psilocybin products are at any given time. And access to psilocybin therapy can only happen at a regulated service center. Facilitators work closely with clients to develop safety and support plans. They go through an entire intake process that's spelled out by the Oregon Health Authority. And the purpose of having this above ground program is really to have accountability and transparency for people who want to seek access to psychedelic healing. What this program is not, there are no retail sales, there's no youth access to the program, and even to enter a service center, you must be 21 years of age or older. There's no locating within 1,000 feet of a school, and there's no offsite consumption. Next slide. So the OHA established a 3-step process for psilocybin therapy. So the first step in their process is preparation, and this is when a facilitator and client connect. So a facilitator can explain the process, review and complete forms, and talk with the client about their goals. Why are they doing this? What do they want to get out of it? And this is also where they'll develop that individualized safety plan. The next part is an administration session. Again, this part is required to happen at a licensed service center. And a client will come, they will work with the facilitator there, they will consume the psilocybin on site, and that trained facilitator will sit with them through the duration of their session. Minimum times are set by the Oregon Health Authority, and they'll support the client throughout the entire process. After that is an optional integration session where participants talk about what they learned and insights and how they're going to bring that back to their life. You'll see before all of these, we've added in assessment. And what we found is a lot of facilitators and service centers are going above and beyond the OHA baseline for the program. So they oftentimes will have multiple client intake sessions even before preparation to figure out if there's any medical considerations. They might send the client back to their medical providers to talk with them and get more information and to really make sure that the client is prepared. And oftentimes, facilitators and service centers require multiple preparation sessions and multiple integration sessions. So let's take a look at the numbers in the program. Next slide. To date, there are 31 licensed service centers across the state. You'll find most of them up and down the kind of I-5 corridor and population centers. There's, as of this morning, 356 OHA licensed facilitators. And by the end of the year, we anticipate approximately 8,000 clients to have gone through the program since it started with the first center opening in May of last year. Next slide. So with the number of clients having gone through the program at 8,000, this is 3 times the number of clients served in all psilocybin clinical trials combined. This is absolutely monumental. And in terms of safety, one of the key metrics we look at is duty to report emergency services emergency service calls, which is required by service centers to report to the OHA if they, for any reason, need to contact emergency services. And to date, there's only been 5 calls, and that's out of 8,000. That's 0.06% of all clients needing to receive any emergency services once they've actually taken the psilocybin product. Some other things about people who are utilizing the program. So we know that a lot of people are utilizing psilocybin for mental health issues, from depression to PTSD, sometimes just for grief. And another group that is being able to access psilocybin therapy for the first time on US soil is veterans. And our partners over at the Heroic Hearts Project have already had 8 different veteran cohorts come through and receive services for the first time in the United States instead of having to go overseas. This program is continuing to evolve and develop. We know we're starting to see more group sessions and unique approaches to reducing costs, but there still is a need for greater affordability, and we'll talk a little bit about some of the work that's being done on that a little bit later. Next slide. So in 2024, Healing Advocacy Fund continued our work to really uphold safety and expand this program. And these are a few of the things that we worked on. The first was strengthening the OHA rules. So we're advocates in this process. We talk with providers. We listen to them and advocate for rule changes through the OHA's process. One is that we led on advocacy to change the rules to allow Oregon to host practicums for Colorado students. Oregon is a leader in this country and on this program, and we believe it's essential to open doors to other states that are forming state-regulated programs to learn from us. Additionally, we supported rule changes allowing for a client support person. And this is a person who is allowed to sit in the room of the client's choosing with the person while they're consuming the psilocybin and receiving psilocybin services. And this was an issue that's particularly relevant to communities of veterans who oftentimes want to have a battle buddy or someone who understands their experience present in the room. We also participated in the OHA's SB 303 Rules Advisory Committee. And one key change that HAF introduced that was adopted into rule is an expansion of safety reporting to include the 72 hours following an administration event. So now if a client needs to seek medical attention for something related to their administration session, service centers and facilitators must report that as a post-session reaction as part of Senate Bill 303. So if they have to, go to the emergency room 48 hours after and they believe it's related to their psilocybin session and they talk with the service center about it, that service center is required to report that. We see this as a huge win to better understand adverse events and client safety. We've also continued to uplift our client safety guide that we did in partnership with the Fireside Project at the end of 2023. And this guide is to help educate prospective clients on the benefits, the risks, adverse events, and really considerations around mental health, family history, and medical things, and how they may interact with psilocybin, and tools for them to engage facilitators and service centers to figure out the best fit for them. We also have continued to engage our work group of service center operators on a monthly basis to talk about best practices, safety learnings, advocate for rules, and conduct skills trainings as needed. And lastly, this year, we've had extensive conversations with people within the psilocybin services community, within the broader mental health community, healthcare licensing boards, and we've started to lay the groundwork for dual licensure in Oregon's program that we'll talk about a little bit further in this webinar. Next slide. So what has all this amounted to? We're seeing transformative change in healing. And what we know is that the program is working. Service centers and facilitators around the state are telling us that even just one psilocybin session can help jumpstart a renewed sense of hope for people who have tried other modalities such as antidepressants or talk therapy without seeing meaningful results. It doesn't solve everything, but it helps people get started on a new journey. And this can lead to significant enhancements in overall quality of life for these individuals, thanks to these impactful psilocybin sessions. So what's coming ahead? Next slide. There's a lot in store for 2025. As I said earlier, this program is still evolving, and 2024 was the year that the program really started to kind of stand up on its own. And in 2025, there's been a lot of work getting ready to study the actual impact and the outcomes of this program. So in just a moment, we'll hear from Dr. Adi Ray from OHSU's Open project, where they're doing real world research on the outcomes of this program. Also, we'll talk about Senate Bill 303, which will come into effect in January of next year. And the Healing Advocacy Fund has also been coordinating research on a community impact pilot, which will release more information next year, but we're going to be studying and working with specific populations, small groups, to really see feasibility of working with folks that struggle with things like alcohol use and other issues, utilizing the Oregon program. Lastly, Healing Advocacy Fund is supporting a psilocybin services program improvement bill. Dual licensure is a part of that, but there are also other things that we're introducing as a part of this bill that we believe that will improve the client experience, improve safety, and build a stronger program. So with that, I'm going to hand it over to Dr. Adi Ray to talk a little bit more about the research that they're looking at embarking on next year. Adi.
Thank you so much, Heidi. Yeah, we're really excited to announce that we are actually alive in the field, actively recruiting folks for the very first large-scale, long-term study of the outcomes of legal psychedelic services. So some of the primary outcomes that we're going to be measuring in this include safety things, as Heidi mentioned, but we're also capturing domains such as mental health and mood, substance use, well-being, spirituality, physical pain. It's an extremely comprehensive and well thought out study. We spent the last 2 years in development, very, very carefully considering what outcomes we were going to measure. And of course, this is just the beginning. This is foundation for lots of other specialized research projects. So this is all, based in Oregon, again, headquartered at Oregon Health and Science University. However, our team at OHSU and beyond is just really the sort of central node in this network, right? Because all of the licensed facilitators and service centers are a critical component of this, distributed community-wide research network. Of course, all of our research has been approved by the OHSU IRB. We've also secured a federal certificate of confidentiality, which protects the privacy of all of the research participants, and that includes both facilitators and their clients. We hold this, confidentiality and data security very, very near and dear to our hearts. We've gone through an extensive security review through all of the different oversight bodies within OHSU. Our software application, houses all of the data in an encrypted fashion. And of course, all of the members of the research team have undergone extensive and regular training on the ethical conduct of research. So the findings that we end up with, after observing what happens, after folks receive services, could have a major impact on the way that we understand how psychedelics impact the human experience. So we'll be, following folks for up to a year after they've received services. And we'll be able to use all of those findings about what are these safety and health outcomes in order to, number one, improve the quality of services and make sure that services are distributed equitably amongst all kinds of people. We're also really excited about the opportunity for all of this data and evidence to be used to enhance the informed consent process for future participants. So, if someone is trying to consider whether or not psilocybin services might be a good fit for them, or they might be a good candidate to receive services, all of these findings can help a person decide, well, what are the actual risks and benefits and potential outcomes of receiving these services? So we feel very strongly about enhancing the informed consent process as people are considering these services. We're also really optimistic that all of the evidence will be very useful to lots of different policymakers. And so we're talking about, policymakers within health agencies, both at state and federal levels, as well as, folks who are making other types of policies, like at insurance companies, whether or not an insurance company would decide to include psilocybin services as a part of their benefits package for their insureds. So we're very, very hopeful that all of these findings will be useful to a diverse group of stakeholders. One of the questions that we've gotten pretty regularly is, how soon will you have these results? So that kind of depends. We will have very, very limited preliminary findings starting in the first quarter of next year. We might have a little bit more exciting stuff to say, and in midsummer next year. But certainly by the end of 2025, we're hopeful that we'll have, a lot to share with the community in terms of the first full year of data collection in this program. We'll be disseminating those findings freely and widely. We have a whole dissemination plan that includes direct conversations with leaders and policymakers, as well as social media outreach, direct media outreach, scientific conference presentations, podcasts, you name it. So it is our primary goal to be sharing all of these results with the people who could do the most with them. So with that, I'll pass it back to you, Heidi.
Thank you so much, Adi, and thank you to Open for the incredible work that you're doing. We know that with Oregon's program and to increase accessibility, we need to demonstrate safety an impact. And Open's work is going to be contributing a ton of information and essential program outcome information that's really needed to increase accessibility for this program. So thank you all for your work and what you're doing. Another component of looking at program usage and program outcomes is going to be Senate Bill 303. And I know a lot of you on the call today know about Senate Bill 303, but for those that don't, it was a piece of legislation that was backed and supported by Healing Advocacy Fund. And it passed in the 2023 legislative session. There was rulemaking this year through the Oregon Health Authority. And what Senate Bill 303 does is help us establish baseline program information, particularly around who's using it and some of the key safety numbers. So service centers will be required to share aggregate data to the OHA. There will be quarterly public reports. The first one will be in April of next year, so keep your eyes out for that. And there'll be adverse events reporting, and this is really the safety information that we're all looking for, and that expanded definition of the post-session adverse event, that 72 hours afterwards. There will also be some demographic level data at the client level, but that's only if clients don't opt out to it. So there is an option for clients to opt out. We believe this is very important, just given the nature of the substances, for people to have the ability to step back, but there will be some that provide their information. Of course, this will be de-identified and aggregated for clients. And so we're very excited that this will be coming in January of 2025. Again, first report will be coming out April of next year. Next slide. So on to the 2025 improvement bill that Healing Advocacy Fund has been working on. So we've been talking extensively with psilocybin service providers, the mental health community, and this bill will be introduced and supported by Healing Advocacy Fund. And the purpose of this bill is that there's changes that can't necessarily be made in rule, or can't be made in rule on a timeline that we think is important for client safety. And so I'll go through a few of these and then we'll talk a little bit more in detail about them. So one of the biggest ones is dual licensure. This bill will allow licensed psilocybin facilitators who also hold other healthcare licenses to be able to bring their skills and expertise to the preparation session and the integration session. And the administration session will stay the same. It'll need to be non-directive. But if you're a licensed therapist, you can actually bring your therapy skills to those bookended sessions. This is huge, and Tal will talk a little bit more about the impact on providers and why this is important. But we've heard this pretty consistently throughout the space that there needs to be slightly more of an overlap with the healthcare community as part of this program. An additional component to this bill is putting protections in law for healthcare providers outside of the program, regardless of where you are, just to be able to discuss psilocybin therapy with their patients. We know that clients and psilocybin services are going to their medical providers, their mental health providers, wanting to talk about this. And we've heard that some providers are unwilling to because they don't know where their licensing boards stand on it. This is something we've borrowed from Colorado. They have protections in their law, and we think it's incredibly important so that clients can really go in with as much information as possible, and healthcare providers are clear that they're able to discuss this with their patients. An additional component of this bill is on dosing and potency. So we are going to require the labeling of psilocin, which is another psychoactive compound in mushrooms, and require the notification of clients by facilitators that there's a potential for increased potency. This is something we've done a lot of advocacy on, and we just really believe in transparency, particularly for clients being able to know if there's a potential for increased potency. Next is client confidentiality. So this bill would require the OHA investigation process to maintain confidentiality. Disciplinary action would still be public, but this would really bring the process in line with best practices that licensing boards and other agencies use to encourage people who see misconduct to report it. So again, this is just really bringing it in line and borrowing some things that we see from other licensing boards that actually encourage people to report misconduct. Lastly, and it's not on here, but I'll add it because I also think it's exciting. We are looking to require there be seats on the advisory board for license holders. That is not currently a requirement. And now that the program's up and running, we're looking to shrink the board a little bit because it was initially developed for the rules process. And now the program is active and requires seats for providers to be on that board. So it's really an informed board talking from the perspective of people who are delivering services. And now I'm going to hand it over to Tal Sharabi to talk a little bit more about dual licensure specifically and why we're looking at that and impact on providers. Tal?
Thank you, Heidi. So maybe I should share a little bit about, to remind everybody that I'm also a licensed professional counselor, and I have my own private practice for therapy, and I'm a facilitator. Right now, the current situation is that I need to wear either hat when I work. So when I'm a facilitator, I'm not allowed to act as a therapist. And that is the current situation. But here's the interesting part, is that many of the clients, I would say 100% of my clients so far, have a mental health diagnosis that would be in the spectrum of severe, either treatment-resistant depression or PTSD, complex trauma, and sometimes really severe anxiety conditions. All of these clients come to see me as a facilitator because they want to see relief for their conditions. And anecdotally, I can say that oftentimes they see changes. So right now, I cannot use my skills in with those clients as a therapist. So I wanted to share with you that there is a limitation in case if we don't have professionals, mental health professionals that can provide their expertise with those clients, we're missing out on a whole bunch of skills and care that can be provided for clients that is highly trained and can give a little bit more extra support for the psilocybin session. And from my experience, and I think that also some research can support that, is that clients see more benefit when they have the right kind of support either end of the experience, of the administrative experience. So also mental health professionals and healthcare professionals are really skilled in working with trauma. A lot of the clients that we work with do come with trauma in their past, and being able to be attuned really, really well to consider the ways in which they can prepare the clients and also work with it if in the administration session there is something that was related to their trauma, can be really, really supportive and can make a huge difference with those clients. And I'll pause here. I'm sure that there will be more I can share during the Q&A, and I'll pass it to you, Heidi.
Thank you so much. So with that, there's a lot in development in this program. We're very, very excited for 2025 to see some of those program outcomes and impact and have some quantitative numbers to back up this program. And I'll hand it back to Lizzie for the Q&A session. See.
All right. Thanks for listening, everyone. So at this point, we're going to open it up for questions. I think we'll do maybe 10 or 15 minutes of questions. Does anyone want to start?
I can start if that's all right.
Sure, go ahead, Mike.
Do you have someone in line in the legislature to carry that omnibus bill, the psilocybin bill?
Yes, we are talking
ahead,
with, absolutely. Yes, we've been talking with some folks and we'll be announcing that in January.
Okay. But you're pretty confident that you'll get a bill in front of the legislature or somebody to carry it in January?
Yes, we are very confident.
Okay.
Any other questions?
I guess I do have more questions if no one else but I
All
don't want
right,
to.
go for it.
So if, and I think somebody mentioned earlier in the call that a lot of the service centers are located around the I-5 corridor, and a lot of places east of the Cascades in particular have said, we don't want these. Are there any efforts to maybe expand that geographic barrier? I know there were veterans in Wallowa County who were dying to get a shot at some psilocybin therapy, but that all got voted down by other folks in the county. How do you expand the geographic footprint that these service centers can move to, or is that too much of a lift right now?
I think that's a great question. And one of the ways that we approach that is demonstrating the actual safety and impact of the program in the places that it's up and running. So I think that the work that happens in 2025 hopefully will help demonstrate and show to those other localities and give real world proof and impact of this program to those localities. So it's something that we're definitely interested in, but we think that expanding that is, but I think that it really is about showing that this program is working and that the fears that some people had about what this would look like are just not coming to fruition. And instead, it's a really valuable mental health resource for a community.
And Heidi, if I,
yeah,
yeah, I was going to piggyback on that and say part of our dissemination plan at Open is specifically to reach out to county level health agencies to share the results of our research. Of course, the policymakers there are going to do what they will with that evidence. But one of the reasons that some of these jurisdictions cited as not wanting these services in their regions was a lack of evidence. And so we feel we play a really important role in helping to assure not only the citizens in those regions, but the policymakers in those regions, just utter transparency about what's happening with this program.
Mike, I think you're muted.
Yeah, and you said there were 5 of emergency calls, service calls related to. That's an awfully small sample size. Were there any trends in those 5?
Not, I mean, it's hard to get trends within 5. They are, this information is public records requestable, so you can pull that from the OHA. But there are all kind of different scenarios. And this was at the last report that I heard several weeks ago. So if there's any that's come in within the past couple of weeks, but it is quite a small number. And service centers are required to report under certain or required to call under certain circumstances. But I think it does speak to the training, the regulation, the screening, and really the process that the OHA has developed that number is so small.
What about affordability and insurance coverage? Are you making any progress there?
So in talking with insurance companies, which we have, the 2 biggest things are demonstrating safety and demonstrating efficacy. Mm-hmm. And again, I think on the program, we're in the process of doing that. It's still a long path, and psilocybin is a Schedule 1 substance, so at least at the federal level, it would need to be rescheduled to have any federal level insurance providers. But we would be open to looking at different options within the state of Oregon to see about subsidizing costs. But we also understand that, again, we need program outcomes and impact on clients and data to show why the state should invest in this.
Yeah, and do you have any data on what a typical if I went to a service center, is there a typical price? Is there a median price for a psilocybin?
Yeah, they really range. For individual sessions, they oftentimes start around $1,000. There's some that are lower. A lot of them are in the $1,500 to $2,000 range. Some go as high up as $3,500. And what we've seen is a lot of service centers providing small group sessions. And these can be done for about $600, and everyone would need to meet each other beforehand. And there's a lot of regulations that go in with that. But that's a much more affordable price point for a lot of folks. And service centers and facilitators in the Shree Art Foundation have really done incredible work at trying to provide scholarships and offset the cost for clients who can't afford to pay.
Okay, I'm going to interject here and see if there are others who have questions. Thank you, Mike, for all of yours. If you'd like
talk all day about this,
of course, yeah, we can talk more. Any other questions in the room? All right. Well, Mike, do you have more questions?
I want to make sure that I understand how dual licensing works.
Sure.
And
Yeah.
a personal story, I've talked to my therapist about psilocybin, and he's obviously licensed in that regard, and he can give me maybe some references. But in dual licensing, then if I were to go ahead and go ahead and do a psilocybin therapy session, I could have him sitting along with me, or how would it work on a practical level?
If they were a licensed psilocybin facilitator and they were also your therapist, they could then say, if this is something you want to go to, we can do this. We'll have to go to a licensed service center, but they would be able to provide that. So if you had a therapist that was just interested in this, that was not a licensed psilocybin facilitator, they would not be part of the dual licensure. So you have to actually hold both licenses. And so your therapist, if they were licensed as a psilocybin facilitator, would be able to do it. And this is really a part of the reason we wanted to do this, is thinking about continuity of care from a client perspective, instead of going to someone that they don't necessarily have a relationship with. If they've been working with a facilitator who's also trained in this field, that they can kind of continue that continuity of care instead of introducing a new person into the scenario, which they, even if their therapist was licensed, a client will always have the option to see whomever they like for their psilocybin session. So they wouldn't be required to see their therapist, but it would give them the option to.
Okay.
Tal, do you have anything to add to that?
I think that, yeah, the continuation of care is one aspect, and also using different specialties that we have and trainings that can really add to the experience. From my experience with my clients, there are moments where either in preparation or in integration, there can benefit more with some of my, in this case, I'm a somatic trauma therapist, so my somatic training can really help client work in a certain aspect of their session and really deepen the benefit that they get from it. Beside the fact that I'm also trained in different mental health conditions, and I know how to attend to different kind of presentations, I know to identify when someone is, for example, dissociated or in extreme anxiety, and I can give the right kind of professional treatment in that case without worrying about whether I'm overstepping my scope of practice, which is the case right now.
That makes sense. Yeah, thanks.
Thank you. All right, I'm going to give you all one last chance to ask any other questions. If not, you are welcome to email questions to me, and I'm happy to pass them on to speakers or arrange interviews as needed. Thank you all so much for coming, and we hope you learned something today. All right, thanks.
Thank you.